morning.
Good morning. How are you doing?
Dr. Murphy.
I'm Mike Sullivan.
Nice to meet you from that.
Ross, nice to meet you.
Nice to meet you.
Still early in the morning.
So,
Have a seat.
okay, so thank you for being willing to meet with me
Oh, you're
and
more than
help me
welcome.
through this.
I understand there are some concerns regarding Mrs. Henderson and requests from her daughter Patty.
Yeah, you know, she just wants everything removed at this point, and it's just too early.
Yeah.
You know, there's no way I can just stop treatment. There's a real potential, there's a real chance for this patient to pull through.
Okay.
And, you know, she may regain consciousness. So I just don't feel good at this time doing what the patient's daughter wants us to do.
Dr. Murphy, can we step back a little bit?
Mm-hmm.
Can you just kind of give me a brief overview of the history of Mrs. Henderson? As I understand, she suffered a CVA
Right.
approximately 48 hours ago now?
I just have to check my chart while it's here, just to be sure. That's about right. It was a 7-centimeter right-sided hemorrhagic stroke.
Which is pretty large.
That's huge. That is quite.
Mm-hmm.
But the saving grace to this is that it's actually hemorrhagic stroke as opposed to an ischemic stroke. So that means, you know, it's a better chance of survival here.
Okay.
There is the possibility that I just do not want to rule out of her regaining consciousness, and you know, she may be able to communicate again. You know, so there really is a good chance that I don't want to.
The chart says that the surgery wouldn't be of any help to her. So.
That's right.
She's not a surgical candidate.
No. So she was transferred here because of that possibility, and so we want to continue to do what we can.
So that's been ruled out.
Yeah.
Okay. If you're asking or referring that it's too early to make a definitive decision, what window of time would you need to make that?
It is really hard to say. I mean, no one can ever give a definitive answer, you know, as far as how long it's going to take. What I would really like is to have several days, maybe 5 days or so that I can get a better handle as far as how this patient is going to fare.
Okay. Is there a possibility to make a determination regarding her brain edema around 72 hours?
So you want to wait another 72 hours and then evaluate?
Evaluate where is she?
You know, 72 hours may be a little bit too premature and maybe too early. You know, I think we need to just give this a couple more days and see. I don't want to feel rushed into withdrawing treatment. These things take time.
Okay. As I understand from reviewing the chart, that Mrs. Henderson cared for her sister-in-law, who experienced basically the same thing, and shared with her family that in the event I sustained a stroke or experienced a stroke, I don't want to go through what my sister-in-law did. And I think that's where Patty's concern is, that she doesn't want to repeat that, because she saw how long it was drawn out. We entertain the option of calling in hospice or palliative care as a consultant, just to review the case and see if the patient perhaps does or doesn't meet criteria, as an option to share with Patty.
You know, we could do that. I still think it's too early to even start going down that route.
Okay.
You know, I don't understand why they even brought her here if, you know, they just want to withdraw care. I mean, she's here in the hospital, that's what we're here for. You know, why did they even, I know why they, you know, brought her here in the first place was to, there was the potential for surgery.
To see if she was a surgical candidate, and that's been ruled out.
Right, but why do they even want to keep her here if they just want to withdraw treatment? I mean, we're here to provide care, and we do have some possibilities to keep her going, and there is a chance of recovery. You know, she may regain consciousness, and I think that it's just wrong to pull the plug at this point.
So what would your hope be for this meeting?
I would like to get the patient to agree to time-limited trial perhaps of several days, 5 days. Let's see what they think.
To get the family.
The family?
Yeah,
The family
yeah,
to
family
agree.
to agree, yeah.
Okay. Can I explore an option with you regarding the principle of benefit versus burden? In that, from the ethical and religious directives, it defines that the burden imposed in relation to the benefits is defined by the patient or the family or the community at large.
And you're referring to the Catholic directives?
Catholic
specific-
directives.
You know, I'm not that familiar with them, even though I work here. You know, I'm
Mhm.
not Catholic in my own background, so I don't really
Mhm.
focus on that. You know, of course, I have to work within the purview of that
Right,
directive, but it's not as familiar to me.
And
So,
Patty is Mrs. Henderson's immediate next of kin. And since Mrs. Henderson previously has articulated what her wish is, we have a responsibility to listen to that and respond to it. If we can't respond to it, we have, because it might be a value conflict of our own, we have also a responsibility to see if somebody else can address that issue for her, either through hospice, palliative care, or even a transfer to another facility or to another physician.
she's just not there yet. There's no...
And I agree, we need a little more time.
Yeah.
We need a little more time. But if the family is not willing to give that time, then we get in a logjam, and what are we going to do?
Well, they have the option of transferring to another institution if they feel that they are not getting their needs met.
True. And in this institution, patients or families can also do a self-referral to hospice.
I just don't think she's dying yet. You know?
Right.
Asking me to withdraw her treatment is tantamount to killing her, because there's no point yet where it's clear that she's in the decline. You know,
Well, hospice has a window
Mm-hmm.
of 6 months, and patients can be admitted into a hospice or palliative care service, and they can also be discharged. And they can be discharged alive. You don't have to die to be discharged at a hospice.
I don't know if she's terminal yet.
Well,
You know, that...
Yeah, I don't have a lot of experience with this kind of a hemorrhagic stroke, so what are the possibilities, the possible outcomes? If she recovers, you know, regains consciousness, do you have a sense of what her quality of life would be?
Well, I don't think that she'll be able to perform activities of daily living on her own. You know, that will be curtailed. She may or may not be able to recognize who she is and
Okay.
but I don't know yet. I need some more time.
And if the supports were withdrawn, would she die as a result of that?
You mean if the ventilator were...
Yeah, if
Well,
it's-
she's right now able to breathe above the ventilator, so
Okay.
there is that possibility that she could just, you know, remain in the state that she's in without the assistance of a ventilator.
Okay, so
have you tried any type of weaning yet at all?
You know, we've done a couple, but just for safety purposes, given
Their
the
O2 sats will
conditioning.
drop, so.
Yeah.
So what do you think, do you have a sense of what Patty's, I presume it's the daughter. Okay, do you have a sense of what her concerns are about her mother? I mean,
Just, you know, the same kind of things that you're saying.
okay, so if there was a possibility of palliative care and pain control and all of those kinds of things, do you have a sense of that's what she's more concerned about rather than other
I haven't really
issues?
explored the
Okay.
palliative care end so much. I'm really just focusing on making sure that we do everything possible to help this patient out. So that's my goal here.
Would you object to the assistance of a consult with palliative care?
Well, we can do that.
Okay.
We can do that.
And let's just go back again. In the event, when we do meet with Patty, and her response to us is, no, this is what Mom wants, this is what I'm doing, and I'm not going to accept anything less than discontinuance of the ventilator today.
I would be disbarred, or not disbarred. You know, my degree could be revoked from pulling the ventilator on a patient like this, because based on the condition she's in, you know, she's doing pretty well. You know, the side of her stroke was not in the dominant hemisphere. There is some good possibility, and I think we.
But her prognosis does not sound positive. If she possibly can't recognize herself or others, assist in her own activities of daily living, then our discharge plan would be long-term care.
Mm-hmm. She could still live.
Mm-hmm. And she could live even if we DC the vent.
There's the possibility. We just need to rule out a couple more things. But I don't feel right. There's no way I can just let go of a patient like this at this time.
And you would feel, am I getting this right, that we need like the full 72 hours minimal to be able to get a sense of what direction?
5 days.
5 days.
Yeah, this kind of thing takes time.
Okay.
We really need the time to.
But I think we need to understand too, the ultimate decision maker will be the daughter, because she's the immediate next of kin.
Well, you know, patients can't tell the doctor what to do. You know, I'm the one who's going to be
But patients are to participate in their care, and they're to understand the alternatives, the risks, and the benefits, and then make a decision whether I want to do this or not.
She can transfer to another physician, but I don't feel right withdrawing care on a patient who's in this condition. She cannot demand me to demand for...
No, I'm not saying she can demand you to do it, but she has the right to secure other alternatives if the plan of care that's being proposed she defines as not acceptable.
You sound like you have a pretty vested interest in.
Well, we just don't know.
Yeah.
You know, I don't feel that it's, you know, it's killing a patient before it's getting, you know, putting the cart before the horse here. We just don't know if this patient is going to reach that stage where it's a legitimate point to enter into hospice. It's a little premature yet.
And I don't think Patty is asking anybody to kill her mom. I think Patty's asking, let nature take its course.
Are we asking for two things here? Are we asking that this consult sort of move towards an immediate decision of, can we wait 3 to 5 days to see how she naturally progresses, and then at the end of that period come together again to decide, talk about what the next step is?
And share what alternatives
I
are.
feel much better doing a time-limited trial, seeing what comes out of it at the end of 5 days, and then moving from there. I just need that time to really get a better assessment of the situation.
Is there any wiggle room in your 5 days? If Patty says 2,
We need the time.
I want to talk to you in 48 hours and I want a decision in 48 hours.
Why
Or I'm just
days?
playing devil's advocate because I don't know what Patty's going to ask, and I don't want any of us caught off guard. Just to look at different alternatives, or do we touch base every 24 hours and let her know where her mom's at?
This kind of thing doesn't happen overnight. I need to emphasize that to you. So, you know, she's here in the hospital. They brought her here. We have many things we can do to see how well this patient's going to fare. And, you know, there really is a good chance of her regaining consciousness. So I think we owe it to the patient to offer that opportunity for her to recover. And if we just keep reevaluating every 24 hours, we're going to undermine that opportunity.
But I think what's also paramount that we need to always have in front of us is the patient has already instructed her daughter, if this happens to me, I don't want to go through what my sister-in-law did.
Is this the same thing that her sister-in-law had? Same situation? Was she in the same exact condition as the sister-in-law?
The only information that I understand that I have from regarding the sister-in-law was that she suffered a major stroke, and that that Mrs. Henderson cared for her over this long extended period of time until she expired. And Mrs. Henderson verbalized to her family, I don't want this to ever, I never want to go through this, what your aunt went through.
So she can transfer. I mean, if this comes down to it, then we'll have to transfer it, transfer the patient. So it's just a really frustrating thing for me because I know that there's the possibility she can be sustained for a long time, and I want to give her that opportunity. And I think it's just too premature, but
yeah, I can appreciate
let's see if
that.
we can get a time-limited trial with this case.
And then you're not opposed to having palliative care or hospice consult to explore options?
We can do that. All right, I believe the patient may be
We'll
here
call
right
later
now.
now.